I'm Alexander Chiu from the University of Arizona in Tucson, Arizona, and I'm the professor of surgery and the chief of otolaryngology at the University of Arizona. So we always say that chronic sinusitis affects at least 30 million people a year, and the numbers of that are probably much higher than what that's been quoted. What we do know, though, is chronic sinusitis is a terrible detriment on the quality of life. And in fact, some studies have shown that chronic sinusitis has a bigger detriment in the quality of life than people who suffer from lower back pain. Because we always think of lower back pain as something that would be terrible to have, that none of us want. Well, let's put ourselves in the shoes of a patient who has a cold that will never go away. So you imagine you're walking around all day long with an inability to breathe through your nose, feeling pressure in your face, not being able to taste anything, not being able to smell roses or smell a good lasagna that's been cooked. And then imagine having those symptoms for 12 weeks, for 24 weeks, for 2 years, 3 years, 4 years, for the rest of your life. And that's what chronic sinusitis is. In most instances, we're able to treat chronic sinusitis with medicines. But there are patients who don't respond to medicines that need another procedure or surgical alternative in order to feel better. The book is Atlas of Endoscopic Sinus and Skull-Base Surgery. Dr. Palmer and I were former partners at the University of Pennsylvania, and we had 2 adjoining offices separated by a very thin wall. And so you can imagine all the shouting that would go across that wall, especially in relation to what surgery we were doing. Dr. Palmer and I had a nice friendly rivalry where we would come back from a surgery and say, hey, look what I did, and look what this case showed, and look what technique I used. And so after a while, we started thinking, geez, we should really put this into a book. We already teach many residents, we already teach many fellows, and each of our fellows and residents would come to us after a surgery and say, look, that was great, I learned a lot, and there's not a great textbook or atlas that actually shows me what you're doing. So it was a natural extension for Dr. Palmer and I then to put our words and our teachings into our pages and pictures of this book. If you're a beginner to endoscopic sinus surgery, it just looks like a big field of red. Okay, so you need step-by-step procedures that can correlate the anatomy as demonstrated by either an artist's illustration or a CT scan or an MRI scan, and then what it actually looks like on the endoscope. And so our students or our readers of the book can literally have a reference in terms of what a perfect picture would look like, and then they can see what it looks like on the endoscope. So we've taken a lot of time in terms of organizing our thoughts in terms of illustrations and CT scans and MRI scans, and then taken a lot of time pairing that up with endoscopic pictures from different cases that we've done over the years. And I think going step by step, using those different modalities of learning, we're hoping that the readers of this book will be able to take a surgical procedure all the way from the preparation of the patient to the closure and the postoperative care of that patient. Yeah, well, the book is a passion, and it's it's one of those things where you want to look back, have a legacy, so to speak, or have something that basically says that I worked extremely hard in order to try to put our teachings into a book. And we're so pleased to be working with Elsevier. It has been a tremendous experience. The editorial staff has been fantastic, very easy to work with, technologically savvy. Our artist illustrator has also been fantastic, has drawn some of the best pictures we've ever seen in the field. And mind you, I've contributed to over 20 different textbooks, and I've written a separate textbook on my own, and these illustrations and the editorial staff blow away anything I've worked with before. So it's been a tremendous experience working with Elsevier. This is an expanding field, and we're hoping that it's not only going to help our U.S. residents and surgeons and practicing physicians that want to try these new techniques. We're really hoping that this actually is a worldly audience, an international audience, because what we do in the States is mirrored by what we do in the world, but it's always lagged a good 3 to 5 years behind in some developing countries. So we really have spanned the spectrum in this book from basic procedures to the more advanced skull-base and tumor procedures. And we're hoping with time, a surgeon in, say, a third world country will grow and feel very comfortable for the first 10 chapters of the book, where they cover basic procedures. And then as they gain experience, be able to reference the back chapters in the book and be able to grow their practice along with the progression of the book itself.